Good day everyone, my name is Junamisi Ontowa, BSN 1 from Section 11N. And today I will be going to perform assessing the cardiovascular system return demonstration. Cardiovascular system delivers oxygen, nutrients, hormones, and other important substances to the cells and organs of the body. It is important because it helps the body meet the demands of the activity, exercise, and stress. Prior to the conduct of the procedure, first thing to do is to review my client's previous medical record if available. Next would be to prepare the necessary equipment needed to conserve time and energy. The equipment that I'm going to use is pen light, a rectangular card and ruler, and also my stethoscope. Third thing to do is to perform a hand washing to enable to protect my patient and myself from the infection and cross contamination. Good morning, ma'am. My name is Junamisi Ontowa, your student nurse for today. Can I see your wristband, please? And can you state your full name, ma'am?
I'm Hygiene and President,
Your birth date?
June 23, 2010.
Okay, and what do you want me to call you?
Just call me ma'am.
Okay, ma'am, now I'll be going to assess your cardiovascular system. Okay, which means I'll have to check for your pulse on your neck and on your arms and on your legs, and of course listen for your heart sound. Will that be alright?
Yes.
Okay, so do you have any questions or clarifications?
No.
Would you mind if I close the door so that no one from the outside will be going to disturb us while doing the assessment?
Yes.
Okay, ma'am, is the room temperature okay with you? Are you comfortable? Okay, well, we'll just begin for a short interview. Okay, ma'am, now I'll begin doing the assessment. Stood at the right side of the client supine with the head of the bed between 30 to 40 degrees, making sure that the head and the torso are on the same plane. Now instruct the client to turn the head slightly to the left and show tangential light sources onto the neck and suprastimal notch and area around the clavicles to observe for pulsation and shadows. If the jugular extension was noted, assist the jugular venous pressure or GVP by locating the highest visible point of distension of the internal jugular vein. Emphasize the distension with tangential lightning. As deemed necessary, raise or lower the head of the bed until the highest visible point of the distension of the internal jugular veins was observed. Now measure the vertical distance in centimeters above the external angle by extending a long rectangular object or card horizontal from this point and and the centimeter ruler vertically from the external angle, making an exact right angle. And now repeat the preceding steps on the other side. Now proceeding to the assessment of carotid arteries. With the head of the bed still slightly elevated at 30 degrees, position the client head slightly toward the side, just being examined, and palpate the carotid artery, consciously avoiding too much pressure or massaging the area. Now, repeat the preceding procedure in the other side. Now, turn the client head slightly away from the side being examined. Place the bell of the stethoscope over the carotid artery. Ask the client to hold his or her breath for a moment and auscultate the carotid artery, listening for bruit. So, if a bruit was heard, gently palpate the artery to determine the presence of a thread. Repeat the preceding procedure on the right side. Now proceeding to the assessment of the heart. Began with general insection of the chest wall. In women, keep the right chest draped. Gently lift the breast with the left hand, or ask the woman to do this for a assistant. Stood at the right side of the client with the head of the bed elevated for 30 degrees and look for any abnormal position. Shown a tangential light across the chest wall over the cardiac apex to make this movement more visible. Now, simultaneously inspect the precardium for pulsation while palpating aortic area, pulmonic area, tricuspid area, and apical area. So, palpate for hips on lips using the palm or hold finger pads flat or oblique against the chest. For thrills, press the ball of the hand firmly on the chest to check for a buzzing or vibratory sensation caused by underlying turbulent flow. Now, palpate impulses using finger pads flatly or obliquely on the body surface from the aortic area, pulmonic area, and tricuspid. Now palpate for the apical impulse using 2 to 3 finger pads. For the finer assessment, use one finger only to confirm the characteristic of the impulse. And if unable to palpate the optical impulse with the patient supine, reposition the patient to roll partly onto the left lateral side and palpate again using the palmar surface of the several fingers. Ma'am, can you roll please? Ma'am, please take a deep breath. Hold. Exhale. Again. And exhale. You can go back to your supine position. Now, inspect and palpate the epigastric area. Now, next thing to do is to assess the heart rate and rhythm of the patient by placing the diaphragm of the stethoscope on the patient optical area. Now, using the diaphragm of the stethoscope first and then the bell, listen for the patient heart sound and on for anatomic sites which are the aortic, pulmonic, tricuspid, and apical area. So first, I'm going to listen for her aortic area. And now, I'm moving to pulmonic area. Okay, now for the tricuspid area. And the last one is for her apical area. Okay, then repeat this step on the other side with patient facing his left lateral side and while the patient is sitting. Okay, ma'am, can you please roll? Ma'am, can you please take a deep breath? Inhale, exhale. Okay, another inhale, exhale. Okay, thank you. You can back to your supine position. Okay, ma'am, I need you to sit down. Inhale, exhale, and hold. Another one. Inhale, exhale, and okay, thank you. You can lay back now. Now assess each arm for size, symmetry, skin color, and temperature from fingertips to shoulder. Noted for any presence of edema, lesion, changes in skin texture, and hair distribution. Now inspected the peripheral veins in the arms for the presence and or the appearance of superficial veins when limes are dependent and when limes are elevated. Now palpate for radial pulse, ulnar and bronchial individually and bilaterally. Now perform the Allen test. Ma'am, please squeeze and open. Please squeeze it again. Open and squeeze it again. Okay, thank you. Repeat the preceding procedure in the other side. Now, examining the lower extremities. Okay, ma'am. Proceeding now to your lower extremities. I see that the color is consistent over and the hair is evenly distributed and your lower extremities feel warm. Now, I'll be going to palpating for your pulse. So, I'm going to start with your patellar pulse. Can you please knee for me? The other one, please. Okay, moving on your dorsalis pulse. Now for your posterior tibial. Okay, and now for your capillary rhythm. Okay. Okay, ma'am. Now, we'll have to do the performance scientist or the reflection scientist, which is the procedure to assess for deep vein thrombosis. Okay, thank you. Okay, ma'am, that we're done with the assessment of your cardiovascular system. And just sum up everything that we've covered upon the assessment. Okay? Okay, ma'am, do you have any questions or clarification before I leave?
No.
Okay, so that would be all. Thank you for your cooperation on this day.